Podiatry wasn't something I was even aware of. I always wanted to work in the NHS, but I never really knew what I wanted to do.
When I left school, the first thing I did was I studied zoology. Then I did a master's degree in conservation biology, and I am not doing either of those things now.
I went to an open day at Huddersfield University and I loved it, really wanted to do it, and basically got onto the course.
It seemed to fit everything I like doing. I like interacting with people, I like using my hands. This was a way I knew I was going to get a job that would use my biology, it would use my hands-on skills. It gave me an opportunity to actually have a career that had development opportunities.
Podiatry is all about managing and treating the lower limb, specifically the feet.
We deal with things from hard skin, corns, callus, and then we also do musculoskeletal things as well. So if somebody has a problem with their walking, if they've got pain, then we can give them insoles. We also deal with wound care, which is a big part of what we do, particularly at the moment with COVID.
I do something different every day really. Even though I'm always seeing patients, I can be in a different location or a different clinic.
Sometimes I'm driving around the countryside trying to find a patient who lives on a farm, and sometimes I'll be sat in clinic treating a whole bunch of different patients with different problems.
It's a huge diverse group of people that we see, and really we are sometimes in severe cases preventing things such as amputations, so we are really making a difference.
A lot of the time we can be the only person that somebody sees in a day or in a week, and it's really nice to have that human interaction with people. You see them breathe a sigh of relief and go, oh, it feels so much better, and that's really rewarding.
There's lots of different routes into podiatry. You can do full-time or part-time, and most recently we've had some apprenticeships starting for podiatry, which seem a brilliant way to get involved and earn as you learn, if you like.
For me, it was 3 years at Salford University. You have some placement there and you have lots of lectures, and then you also have placements in the NHS, in the community, learning how to do the job and how to be a podiatrist. You're treating real patients from about week 6, I think, so straight away you're dealing with real people, and that's really important.
If feet bother you, then you probably shouldn't go for podiatry. But absolutely, if you've got an interest in healthcare or having a job in the NHS, contact your local trust, and I'm sure they'll be more than happy for you to come and shadow one of the teams. It's brilliant just to get an insight of what we really do and just see if it's something that suits you really.